Good morning, everyone. Welcome to day 44 of Vine Health COVID-19 updates. I hope you're all doing well today. I just thought today I'll come and just give you a few updates as to what's happened from yesterday, and also how we plan our health going forward. So it's day 44. What Vine Health does is bring you facts and not fiction and help you thrive during this COVID-19 pandemic and beyond. So that's what we're here for. Thanks for those who have engaged and shared our videos and sent questions in. Very much appreciated. Yesterday, if you missed yesterday's broadcast, we tackled vitamin D and COVID-19. We talked about a lot of things as well, including how COVID presents in children and what we're now seeing in the United Kingdom in children. So if you missed that, watch day 43, which should be on our Facebook page yesterday. So today we'll be talking about health planning, because the lockdown measures are going to be eased soon. So just planning for your health. That will come towards the end of the broadcast. But I'll give you a few brief updates from as usual. United Kingdom, we know the deaths now are at 21,092, which has gone up by 360 up until yesterday. That's better again. It's slowly improving. As I always say, each one of these are people, are souls, are people who are very important. So our hearts go out to them, for anyone who suffered any loss during this time. Also in the United Kingdom, so that you know, the lockdown measures are going to be reviewed on the 7th of May. So that's next week, it will be reviewed. And my suspicion is that they will start to ease the lockdown from next week. That's what I suspect. We'll see. But just follows the trend of what's been happening in other places. Also, just interestingly, we talked about PPE yesterday, I believe, and COVID testing. And there was a program on BBC on Panorama yesterday talking about PPE. If you haven't watched it, I would recommend that you recommend strongly that you watch it. So it's now on BBC iPlayer, and it talks about whether the government has failed the NHS or not. So I found it very interesting watch, and it's quite a challenging thing to watch, and particularly being in a leadership position in the NHS, when you know that you need more PPE and you're not able to get it. Watch it if you didn't watch it yesterday. Just also say for the UK, I mentioned about children and COVID. Please, if you know anyone, any parent, any child who's presenting with any abdominal symptoms, please strongly advise them to speak to their GP, because it can be a presentation of coronavirus. And we've had some children die from this. So please, if there's any child complaining of abdominal pain, speak to your GP, let them review that child and possibly refer that child to the hospital if needed. Yeah, so many other countries are reviewing their lockdown measures. Areas in Australia are easing that. Switzerland has eased its own a little bit this week as well. So many areas. So it's coming to an end. So you have to start thinking about, how do you cope going forward? How do you make sure that your health is in top form going forward? Now for Nigeria, the deaths is the number of cases, apologies, is 1,337 with 40 deaths. The president came online yesterday and said that the lockdown measures will start to be eased from the 2nd of May. So lockdown will go on until Saturday, and state governments will decide how they want to ease their lockdowns. So again, that's happening. Kano, on the other hand, like I mentioned yesterday, Kano has been locked down completely for another 2 weeks. And there's also should not be any interstate travel, even when the lockdown measures are being eased, except for essential work. Curfews have also been introduced in Nigeria. That's very odd. So curfews from 8 p.m. to 6 a.m. in the morning. I'm not sure, maybe it's because of midnight vigils and things, but again, everybody should stay indoors from 8 p.m. till 6 a.m. Lastly, the United States, 56,000 deaths so far, just over 56,000, unfortunately. They've also offered small business support. The website crashed when they released this small business support website, went live. It crashed completely. But again, it's available. If you're a small business owner in the US, please access the funding that is available. That would be wonderful. The lockdown is going to be eased as well in the US. They're doing that with a lot of testing, state by state. So each state should be offering testing for its people. Thank you. And they're saying they're going to be testing 2% of all the residents of each state, prioritizing emergency workers and vulnerable people. And it will be supported federally, it will be managed by the state and locally executed. Very nice, you know. So that's that for today. I'm just going to finish off. It's going to be a short broadcast today, talking about health planning, particularly in the Black and minority ethnic groups in our community. Planning your health, because as the lockdown gets eased and you start to go out again, we might have a second spike in COVID-19, and you want to make sure that you're in the best health possible. So what will I say a health plan is? A health plan is just making sure you put in your prevention measures. The first of those things is that if you have an underlying illness, that you make sure that it is stable. So if you have hypertension, diabetes, or any other illness, make sure that it's stable. And the way you can do that is to liaise with your doctor. Secondly, is to put in things like exercise. Exercise, I would say, is almost right after that. Exercise is number one. Put in a plan for your exercise. Write it down and stick to it. I always say, aim to have at least 6 days of exercise a week. And it can be any kind of exercise, as far as it's 30 minutes and your heart rate goes up. I generally strongly recommend running, walking or running, because that's my go-to. And it works everything. So put in a health plan, put it in place, because if you're slim, if your tummy is flat, then you're less likely to get complications from chronic diseases and from COVID-19. Also remember your supplements as well. Don't forget your supplements. So you have managing your health. Thank you. Managing your health, any diseases that you might have, so that it's stable. Putting in your exercise plan 6 days a week, even if you start small, but aim for 6 days a week. And also thinking about supplementation. Number one in those supplements is vitamin D. Take your vitamin D. If you have dark skin, take vitamin D. And if you have the extra capacity, take vitamin B as well for your memory and for your brain, particularly as you get older. And those are the 3 things I'll say today in terms of health planning. There are many other things, but again, start small and then build on that. There's also things like meditation, you know, all the other bits that are there. But those are the 3 tips for your health plan as the lockdown measures begin to ease, so that you're in the best fighting form possible to fight off disease and to remain strong. Thank you everyone for watching. Can I ask that, I know that my broadcasts are generally watched throughout the day and the views increase as the day goes on. Please like, share, follow, just do what you can so that you can spread the word and we can increase the health in our community and we can just be better. Thank you. Share it if you've missed it and you're joining later. Watch it all and I'll see you again tomorrow. It's every day. We're going to continue until this eases and then we'll reduce it. So maybe once a week. You guys take care and have a great day.